Okay, we're live.
Okay. Good evening, everyone. My name is Elizabeth Thomas Parker. I'm your Vice President. Welcome, Local 99 members and staff. If you have any questions during the meeting, you can type them in the Q&A. Organizer will be responding to some questions directly in the Q&A. Our panelists will also be addressing some frequently asked questions at the end of the meeting. We won't be able to get to everyone's questions tonight, but if we are not able to answer your questions today, an organizer will follow up with you. For those of you who are on the phone, you can also send your questions by submitting them in the inquiry form on the website at seiu99.org/inquiry, and the organizer will follow up with you also. I also want to remind you that this meeting is being recorded and it will be posted on our website at seiu99.org this week. Now, I will hand it over to the SEIU 99 Executive Director, Max Heiress.
Thank you, Sister Parker. Good afternoon, sisters and brothers. Welcome to our first meeting of the year. First, we'd like to start by just in the memory of those of our members and their family members who have succumbed to COVID-19 and or have been ill. I want to call us to have a minute of silence, please. So I will start measuring the minutes starting now. Thank you. So as we begin this, remembering the past, but also continuing to organize and continuing to unite to get to future, so that when this is over, all of us, our families, the students we serve, are in a better place than before COVID hit. We have to continue to organize and push back to ensure that there are safe working conditions, as all of us have been doing. We are in LA. Of course, we're in the epicenter right now of this, but we have to continue, and through unity, we can get through this. So I'd like to start to speak today. We're going to talk first. We're going to frame the goals for 2021 for our local, and then we're going to go on our presentation around vaccination. We have some doctors visiting. We want to appreciate Dr. Mrna and Dr. Gonzalez for coming today, and they're going to talk to us a little later as well. So this year is, of course, not a normal year. Again, following 2020, all our contracts are basically either open or in a reopener. Furthermore, there needs to be additional investment, and there needs to be additional funding and resources for schools and or college campuses to reopen in a safe manner, and to support family childcare providers and early educators that are currently operating and are struggling to get by. So it is important to continue our fight. Just want to remind us on some success to build on. Last year, through all our organizing, we managed to secure agreements with employers that ensure safe conditions. And in many instances, these for LAUSD and others gave additional what we call hero pay to workers that were actually struggling in the front line. So we must continue to push. We also achieved a no layoff, no reduction in hours, specifically in LAUSD, given that the state did not protect our jobs as a whole, only some of our jobs. So that's where we organized. And when we were threatened by a district to lay members off, Santa Monica, Malibu, we came together and pushed back. While we didn't have the 100% win, most of those workers are back to work and we haven't stopped. That way, employers need to understand that they're not going to balance their budgets on our back. We have to continue to organize and push back. But we are called to do things differently this year. We depend largely the districts for districts to continue to operate the districts that we work at, all the districts. There needs to be funding allocated specifically for the safe reopening and rebuilding of our infrastructure of our schools and our community college campuses. Specifically, this funding has also has to be done in an equitable manner. What is happening right now, we're entering that budget process in which the state allocates its budget. And the way the governor has proposed a budget, it would literally take resources away. We will learn later about how this is resources away from urban districts, large urban districts, and districts in which Black and brown folks live, and also people of other people of low income. And that's exactly who's going to be, who is right now suffering more. It will take resources away from those communities. So the other ad will give it to other communities that are more affluent so that they may reopen sooner. That is what the net effect is. The budget Governor Newsom has put there does not consider that there's going to be an added cost in all districts for reopening, given that there has to be enhanced cleanliness, there has to be more classrooms because classrooms are actually going to be populated less. There has to be more adults supporting the students. That's the work our members do. There has to be, there's going to be need to for more buses because there's going to be now more shifts. The classes will potentially be staggered. So there's also going to be a need for more family childcare providers to be supporting parents when the economy reopens. And for that to happen safely, there needs to be more resources. We cannot allow this budget to just pass as it is, because that means less resources. And when districts have less resources, they target us. And not this time though. This time we're going to be organized and they target us, and we are going to push back because we are essential. But to do that right, we have to work, and there's going to be work to be done to push the legislature and the governor to pass a budget that reopens the school equitably. There must be a consideration for the community around the school. If the community is at a higher level of COVID-19, the state needs to figure out how it supports those communities to lower the instance. Otherwise, the schools will never open in those communities that are constantly in purple tiers. And we know those are mostly Black and brown communities. So we need to secure and we need to unite with our sisters and brothers from other locals throughout the state to do that as well. We have to do that, and we also need to expand our community work, continue to work in coalition with others that are not labor necessarily as well, to continue to advocate for these matters as well. We have full contract campaigns open. Full contracts open in many jurisdictions, including family childcare providers. So we have to then be ready to use these contract campaigns as we are fighting for funding from the state. Use the contract campaigns everywhere in all our districts, all our early ed centers and Head Starts, all our family childcare providers who are right now currently also bargaining, as well as community college districts. I'm mentioning all our members because everywhere we are either open for a contract. So we fight for funding from the state, and through our contracts, we fight to ensure that that funding gets to us. So we have to stay active in both fronts. Money from the state, we have to create crisis from the state so they won't forget us. When you read the paper, it says vaccines for teachers. We know that we are also getting vaccines only because we all have advocated and demanded it. But remember, we are invisible a lot to the public. So we have to continue to do the work that we do to ensure that, that we are respected as the professionals we are. So we have to, the other thing we have to do though, to be able to achieve all of that, is we have to grow our membership. We have to get to 70% membership. We are as strong as our membership. When a school district or a Head Start looks, for example, options Head Starts, right? Only about 30% of our members are member in that Head Start. We need to work really hard, and we have been, to ensure, because the boss is a union buster, to ensure that that grows. But to make sure that that grows, we also have to make sure that that grows. We also have to support those workers because they are in fear. So that is something that we have to ensure that we do, is get our membership up to 70% to continue to show strength. Imagine in LAUSD, if we're only at 60% membership, what do you think they think? Right? So that is important for us. So this year we have to secure funding from the state and the federal government. We have to fight in our districts, jurisdictions, Head Starts, and as family childcare providers to be able to ensure that that funding gets to us directly and thus support the families and students that we serve. We have to fight for that funding to be equitably distributed. That means communities that need it the most should get more resources to be able to catch up. That's what equity, as we all know, means. And then as we're doing all of this, we have to do it with power so that we win in all our contracts and we can have future improvements. We can do that this year, but we can only do it if we continue to fight and organize. Understand that we're in the middle of a pandemic, but this is what we're called to do. And I'm pretty sure and I'm very confident, given all that I know a lot of you and a lot of our leaders, that we can get there. And we do all this through also growing our membership. So thank you very much, Sister Parker. I'm going to hand it right back to you.
Thank you, Max. Okay, next, we would like to talk about the issues that will impact all of us. That's the COVID-19 vaccine. As education workers, we know that we're on the we're the next in line to get the vaccine. While there is no clear timeline yet clear timeline yet on when it would be available, I know many of us have questions. Joining us today to share more information about the vaccine is Dr. Lorenzo Gonzalez, who is a family resident physician at Harbor UCLA Medical Center in Torrance. He is also a fellow SEIU member. He is a regional vice president at SEIU/CIR, the Committee of Interns and Residents. Also joining us would be Dr. Amber Laura, a family medicine doctor at Harbor UCLA Medical Center. Thank you both for joining us today. Dr. Gonzalez and Dr. Laura will present.
Hello. How's everyone doing? All right, so I'm going to share my screen so we can start the presentation. I think this is an important topic, and I brought one of the coolest doctors I've ever met, which is Dr. Lara. So I want her to introduce herself as I start the presentation.
Hi, everyone. Thank you so much for having us. My name is Dr. Amber Lara. I am a family medicine resident along with Dr. Gonzalez at Harvard UCLA Medical Center, one of the county facilities here in LA County. I also wanted to just share that my uncle is a part of the Local 99, so very happy to be able to share our information with you guys. And I know that you guys are also experiencing a lot, as we are as well in the hospital. So my best to you all. And I hope that you guys feel very informed by this presentation. If you have any questions, I saw some of the questions in the chat already. I would love to be able to answer some of those questions as well as we go through the presentation.
Awesome. So the only caveat is that I can't see the chat and I can't see other people. So I'll be moving the presentation. I'll be talking, but please interrupt me. This has to be a conversation as much as possible. So with that, let's start it off. So the biggest thing is that this is what we're fighting against. This is the coronavirus, and these red things is what makes it look like a crown, therefore the name coronavirus. We're going to go through to really understand the science behind it. And I know that the first time I looked at this, I didn't get it. So I'm not expecting everyone to understand it, but I think you all should know exactly what's going on, especially as we're getting these vaccines. One of the things that we're looking at is that this virus has a makeup inside. So we'll go into that in a little bit more detail. And the whole goal is, how do we get from, virus to syringe, and most importantly, vaccine? Because what I was, one of the greatest quotes that I learned today is that the vaccine won't save lives, the vaccination will save lives. And therefore, we need to be able to move that from vaccine to vaccination. So that's something hopefully we can demystify today. Anything you want to add to that, Dr. Lara?
Nope, that sounds about correct.
All right. So now as we move forward, this is, there's two main types of vaccines. You'll hear the Pfizer and the Moderna, and then there's other ones that they're still not out yet. They might be out in the future, and a lot of their data hasn't necessarily been out there, so I won't focus on those. I want to focus on what's being given to y'all today. So both of them are 2 shots, and both of them have some weeks of separation. So meaning, the Pfizer one, 21 days, and you have to be 16 years or older. That's just the way the study was made. And then the Moderna one is 1 week more. So instead of 21 days, we're doing 28 days apart. So you take your shot, you got to wait about a month for the next one. They're all administered the same way, right to the muscle. And if you get the Pfizer, you have to get the same one the next time. You can't mix them. You got to go Pfizer with Pfizer or Moderna with Moderna. And, they're both really, really, really effective. So you're looking at 95% effective at preventing, and this is key, y'all. This is very key, preventing the illness for COVID. So that's something that we'll touch upon more later.
I can add on to that. I did see some
One
questions.
of the things that we really are looking for the ingredients, right? Everyone is thinking, well, what's in it? What are we actually receiving? What are we injecting into our bodies? The big, the concept that I think is the hardest one is going to be the messenger RNA. This is it's very interesting and cool technology, in the sense that we're using something that our body does every single day and just kind of tweaking it a little bit in order to help us fight the coronavirus off. So I want you to see it in red. And then the other thing is lipids or fats. This is what's the container. Think of it as the shipping container that's taking the mRNA, which is the active ingredient, into our cells. And then everything else is a salt, it's a sugar. It's just there to make sure that the lipid and the mRNA don't fall apart. The differences between the vaccines is just the differences in the ingredients, particularly the salts and the sugars. So let's just take a quick look at that. This is a very busy screen. I understand that. So I try to color coordinate it so you can see where the mRNA is. Everything else in green is going to be your lipid, your fat, your container. And then the bluish type of purple color, that's what we're looking at as your salts and your sodium. So these are your components. And I try to keep it as much color coordinated as possible. Before we go into how all of this is actually functioning in our body, how it's functioning in my body, since I took it already, is that everything that we have in our body is made from cells. This is like the single point. It's the smallest thing that lives in our body, and through its organization, it develops tissues and organs, and then that's what makes us. So we're going to be focusing on the cell. So anything that's in your body at one point, at the smallest level, has cells. So going back to this image, right, we have the virus on our left, and then we have this vaccine. That is actually the vaccine that you see in this little green area. That little swirl around there, that's the active ingredient. That is the mRNA. And the green coated around it, like I mentioned it earlier, that's going to be your shipping container, your fats. What is the red thing in there is actually trying to code for the spike protein, which is that red thing that's shooting outside of the virus. Now, how does this actually give us like an actual defense? How does this protect us? Well, we inject it into ourselves, and this will go into our cell, like our regular bodies. And then we have an actual, think about it as a warehouse. Think about it as so many things are happening, but at the end of the day, we create this product. We have figured out how to create the spike protein that is not the actual virus. It is not what gets us sick, but it is the part that will identify the body. It will tell our immune system, it will tell our defenses what to look for. So it will then go into it, use our own machinery, use our own tools in order to create this spike protein. Now, as you can see here, we've created the spike protein. We created it because we injected the actual code, we injected the actual instructions for it, and that is the mRNA. And now it's being shown outside the cell. And through another process, we create these things outside. Now look at these like very interesting kind of like a Y shape. Those Y shapes is what we're all trying to get. The Y shape is our antibody. And the way our body produces, there's special cells. These are what we call our immune cells. There's various different types, but ultimately we have to activate them. We have to press the on button onto them. And that is why it's important to show our body what is this spike protein, which we're able to do. Once it sees this spike protein, then it creates all the antibodies. It's like, oh, I figured it out. I know what I'm looking for. I will now produce this to protect the body. And that is the immunity. So if we go back to that coronavirus, so we're immune. We got the vaccine. It went into our cells. We developed the antibodies. And let's say we were walking down the street or we are gathered somewhere. We are then, the coronavirus comes into us. And then we have our antibodies to block it. That is the immunity. That is the purpose of the vaccine. Now we have these antibodies. These antibodies know exactly what this looks like, and we can stop it at its track. Anything to add, Dr. Lara, right there?
So I did want to address some of the questions that I saw in the chat, asking about whether or not the vaccine is mandatory. I'm not exactly sure of the workplace requirements, but because this vaccine was authorized
Dr. Lara, would you like to pick up the slide?
Sorry, can you not hear me?
We can hear you, Dr. Lara. I don't know if Dr. Gonzalez can hear you, though.
Okay. So because this vaccine was authorized under emergency authorization, it is not actually a mandated vaccine through the federal government. And I would also say that some of the other things to know about this is that mRNA technology has been present now for decades, and there are some other types of mRNA vaccines, but this is the first one that has been approved by the FDA for mass use at this time. Other places where mRNA technology is used is through cancer research and cancer treatment as well. But the other thing is that I'm trying to get all of the questions in here.
Yeah.
If you have had coronavirus before, you should still get the vaccine, because even though you'll have natural immunity from the virus, having the vaccine will create a more robust immune response. And we're not sure what type of individual immunity people can have. With the vaccines, we know that you will create antibodies against the spike proteins. And at this time, given the variations of the virus that are in the environment, they have been shown to be effective towards some of those variations. I understand that Mrna is currently undergoing research to create vaccines to combat the other types of variations that are coming up in the community. Now, because the vaccines are 95% effective, there is a small chance that you could still contract coronavirus, but that chance is very small. And likely, if you do contract it, if you do test positive for it, your symptoms will be much more mild because the vaccines have primed your body to attack the virus when the virus is presented to your immune cells.
Thank you, Dr. Lara. I don't know if Dr. Gonzalez, I think you had trouble hearing Dr. Lara, so just want to let you know that she wrapped up her comments. And we're also, staff is collecting some of the questions. So once the presentation is done, we can elevate some of the more common questions to you all, and you can answer them then as well. Go ahead, Dr. Gonzalez. Dr. Gonzalez, can you hear us? Okay, I just messaged Dr. Gonzalez in the chat, who apparently can't hear anything. So
Okay, I can try to take it from here. So how safe is it? So the safety, there has been shown to have small side effects, especially with those people who do have more of a reaction, more of an allergic reaction. Things like if you have an EpiPen, if you've had what's called anaphylaxis before, where you kind of had that throat closure, those are the types of populations that we think should be more careful when receiving the vaccine. And the study did include many thousands of people, which gives us some reassurance that many people were studied in order to receive the vaccine, and their safety and efficacy was followed. And the government will continue to follow the vaccinations for quite some time as well.
let's try to, I don't know if Dr. Gonzalez, can you hear
I
us
can
now?
hear you all now. Thank you.
Great.
Yeah. That's the next slide.
Okay, so many of you have been asking about the side effects in the vaccine, and many of the side effects are sort of a hallmark of your immune response being activated, such as fatigue and headache. Other symptoms that people might feel are body aches and pains and mild fevers, and of course, pain at the injection site. These usually last for a few days after administration and should reside. I often tell my patients that they should take a day of rest, try to take it easy, drink plenty of fluids, take Tylenol if you need to. And then there on the right-hand side is some of the more serious effects. So many vaccination sites will allow patients to be observed, at least in their cars, for about 15 minutes after administration to watch out for these more serious side effects.
Yeah, the only thing I would add to that is the idea that the anaphylaxis is that scary one that we're all looking for. And like you said, the reason why we are trying to watch you for 15 minutes, and anaphylaxis means that your body is having a very severe allergic reaction to the point where you cannot breathe. But the thing to be like assured is that it's really, really rare chance that it happens. And it's at the same rate as any other vaccine that we pushed out there. So it's actually not the big scary thing, but we want to be prepared when it happened. And over the last weekend, I vaccinated 200 people, and I had no issues with this. And then that Mrna one, people hear it in the news. It was held for a while, and we ended up thinking that it was actually all by coincidence. Everything that happened was not caused by the ingredients. So there is no reason why people should hold off on using the Mrna vaccine. And I can start the conversation about, you know, I'm going to be very transparent with everyone. And I think Dr. Lara is in the same, in the same communication about how what we don't know and what we do know. We like to speak on the things we do know. And as a community, the question that I always get is, if I get vaccinated, can I still catch the virus and will I infect someone else? The real answer is we don't know that 100%. What we studied, what the community was studying was that when we give you the vaccine, you won't end up with symptomatic COVID, meaning you won't end up going to the hospital. You won't end up needing to be in the ICU. That is what we looked at. The question of, if I get the vaccine, can I still get infected? We don't have a stance to say that. So therefore, we want to make sure that people are still masked and still practicing social distancing. But just because we don't know what it means, we also, that's something that we can think of historically, how vaccines have worked in the past, is not to say that in the future, we can't say that, looking back at it, it actually is protecting us. But at this moment in time, we cannot say that. And I think this is really going to the part where I see a lot of the questions out there. Who should get the vaccine? Honestly, the majority of the people should be getting the vaccine. The times you should talk to your doctors is it's kind of a smaller list of people that should be doing that conversation, right? Obviously, you should always want to talk to me. That's the whole point of having a primary care. We're there to listen. But if you have severe allergies, you should probably make an appointment with your doctor. Bleeding disorders, blood thinners, immunocompromised, if you're on chemotherapy, if you are pregnant or breastfeeding, these are things that the study didn't look at these people individually. So therefore, we cannot say 100% that there is no contraindications, but at the same time, we don't see any interactions. The way the mechanism of of the vaccine, the way it works, it should be fine for most. The only group that we do say you should not take this vaccine is people who have an anaphylactic or severe allergic reaction to the ingredients. That's why it's really important to see those ingredients. And you might say, well, I actually don't know. The most common when people have an allergic reaction is called the polyethylene glycol, which is otherwise known as PEG. That's probably the one people hear the most of, like, okay, that's the one that I might be allergic to. But outside of that, it's really safe vaccine, and it should be for most. Dr. Lara, would you like to take this slide?
Yes. So myths about the vaccine. So yes, if COVID has been affecting many people in the population, and a certain small percentage of those people experience severe disease, this is true. But I think many of us have seen that how widely this has affected our communities, our families. And so we do recommend that everyone get vaccinated to help to prevent further transmission of the disease, further symptoms of the disease. At this time, it got really scary for us at the hospitals because we were having to decide whether or not to admit patients, whether or not those patients needed to be hospitalized given their comorbidities and their chances of surviving. Luckily, we're kind of coming down from that, from rationing care. So those are things that we don't want to see, right? Those extremes. The other important part about vaccination is that it prevents the virus from further mutating and further becoming even more infectious within the population and affecting us. And as many of us have already spoken about today, the death rates and hospitalizations are especially higher for those of us who are Latino or for our Black populations as well. So we want to make sure that we protect our communities in that way. And can you get COVID-19 from the vaccine? No, you cannot. There are no actual viral particles within the vaccine, just that mRNA, that blueprint for your body to create that protein, which your body already identifies as a foreign object, right? And will create those antibodies and create a more robust immune response.
Yeah, the only thing I'll add is, when people say, well, what about, if I just get COVID-19 and I get immune that way? One answer is, A, we don't know the length of the antibodies. And then B, we definitely don't want you all to get the long-term problems, right? So there's like issues with clotting, and it can affect your heart. These are things we see. So when it comes to like between getting it through getting the vaccine, just kind of the similar logic we used to understand with the chicken pox, right? Let's get all the kids together. Let's get the chicken pox. We're done with it. It's not necessarily the best logic, especially now that we have this vaccine that is so highly effective. Yes, this is like an immunization. So a couple of more, myths that we hear is mRNA a new technology? No, we've known about this. This is something that we've used in college, and even now it's actually spreading to like high school. People are using mRNA technology, and it's really the future. Now there's new looks at how do we apply this to HIV. These are the new technologies that is based on old work that we know very, very well. So that's why it was going to the next one. Was this made too quickly? I mean, the process that needed to be done was done. We call it phase 1, phase 2, phase 3. That was actually done. All the other stuff that usually takes a long time, that was kind of pushed to the side because we knew the severity, we knew how much this needed to be done, and how quickly we were trying to push it out as quickly as possible, but making sure it was still safe and it still went through those phases that every medication would go through. Does it alter my DNA? I think that's a really good question that I hear a lot. Because we're talking about the mRNA and DNA. And the big thing is no, because the DNA, we're not entering where the DNA is held. And the way I like to make an analogy for this is like your DNA is those special books. When I was growing up, it was the encyclopedias. Those couldn't come out of the library. Those were books that stayed in the library. So the DNA is in one place, doesn't move. What does move is the mRNA, and that is the photocopy of those books. That is the photocopy of the encyclopedia. We're not even touching, we're not putting anything into the DNA. That's why the COVID vaccine cannot alter your DNA. And then a lot of it is, this next question is does it cause sterility? I think this really comes from just the lack of, we acknowledge that the medical community has done some pretty bad things to, communities, especially Black and brown communities, marginalized communities. And it wasn't too long ago when people were being sterilized against their will. But, the COVID-19 vaccine, the way it works, what is inside of it has nothing connected to sterility or fertility. And the wearing a mask after receiving it, I wish we could say no to this right now. Hopefully in the future we'll be able to say no to this, but going back to the way the studies were built, the way that we looked at the evidence, this was not studied. So if it wasn't studied, we don't put a stance on it. Therefore, until future studies figure out exactly what is going on in that regards to if we can still be infectious, if we can still get the coronavirus, but not have the severe illness, right? Not have to go to the hospital, not have to be in the ICU. We still have to use the vaccine. We still have to use the masks, and we still have to be social distancing. that is how we're going to be able to bring this pandemic to a manageable level. And we saw during December what happens when we don't follow these three things. In regards to variants, I think this happens a lot. I think people talk about, well, it's mutating, the flu mutates. Well, we need to have new vaccines. Currently, these are the ones that are more actively, you hear them a lot in the news. They come from Brazil, they come from England, they come from South Africa. Right now, it looks like the vaccines, the Pfizer and the Mrna, are still having enough of, they're still effective to these variants. So that is always good. And this is what we want to avoid. This is towards the end of our presentation. This is what we see and why I'm here. And this is why it's so important for all of us to really just understand more about COVID-19, to understand more about what is actually happening in regards to the vaccine, because these are the things that are being perpetuated. These are the things that are being spread. This is what people are hearing. And I can tell you, can you still spread the virus? We just said the data doesn't show that we can say it doesn't. But it also doesn't show that that you are spreading it. So, that point right there is really rooted on just ambiguity. It's really rooted on doubt, right? The 2-month immunity, that comes from, the study only lasted for 2 months, but we're still going to be seeing these people for the next 2 years people were in the study. Yes, the study only went for 2 months, but we're not saying that you only get 2 months. We will continue to follow those individuals. The 10 or 15% reaction rate, that is your body producing, the reaction rate, those symptoms that you get, that is your body producing an immune response. That means that it's actually creating the antibodies. The 10 or 15 comes from what Donald Trump was talking about. I don't trust anything that comes out of his mouth. Increased HIV, that's about a different vaccine that's not even associated with the Pfizer and the Mrna, but you hear it in the literature. Bell's palsy, that one is the level of Bell's palsy that we were seeing was the exact same as if the vaccine didn't even exist. So it's general population. It's at the same rate. There's no increase rate. And we saw the anaphylaxis. That is something that we understand can happen, and for some people will happen. So understanding what your severe allergies are, but we're there. When we give you the vaccine, we have the appropriate medication and we have the appropriate response to make sure that if it does happen, we can control it and we can address it. And like I said, yes, we still have to wear a mask for right now. But as you can see, these type of things, without further understanding, without further knowledge, it makes it really difficult for anybody to really want to take the vaccine. So hopefully we are here to answer more questions if there's still more time. The last slide we have is, it works. This is from the paper. And as you can see, the blue line that goes up is the ones where people did not get the vaccine. The red line on the side is the people that did get the vaccine. And the higher you go, it means that you're getting more symptoms of COVID. So the people, when you get the vaccine, it will stop you from getting COVID, the COVID disease, COVID-19. And this is just, looking at the graph, you can see the big difference and why we're so adamant about making sure that our communities, the people that are in the front lines, the people that are, making sure that our society will open back up, they are protected. We don't want to see them die anymore. This study is by the Pfizer. This was the Pfizer vaccine study. Amber, anything? Dr. Latta, would you like to add anything else? So I'm going to stop sharing my screen right now, and then we can, if there is time, we can definitely answer more questions.
Thank you so much, Dr. Gonzalez, Dr. Lara. We do have a few questions and we want to sort of pull out. We won't obviously be able to get to all of them, but we want to uplift some of the more common ones, some that I think you'll have already answered, with Dr. Lara in the chat, and both of you out loud. But nevertheless, I think that some of these are so common that they might bear repeating, right? So I think one question, and folks have talked about different pre-existing conditions, right? So if I have diabetes, if I have kidney disease, is it safe to get the vaccine? Can you maybe speak a little bit to some of these pre-existing conditions and also the weighing out of the risks that COVID poses if you don't get vaccine versus whatever pre-existing condition you might have? Some of the other conditions folks put out there are asthma and other autoimmune diseases. And whoever would like to answer.
So that's an excellent question. And I would say that, we do recommend that our patients receive the vaccine, even with their comorbidities, right? So some of these things like high blood pressure, diabetes, renal disease, liver disease, especially because we have seen that COVID is more deadly in these populations. So if you have not had COVID up to this point, and you have these types of conditions, it's highly recommended so that you can avoid the sort of more severe and deadlier consequences of having COVID. And then if you have more of a more like complex immune history, then those are definitely some things that you can discuss with your regular doctor or with any specialist that you see, especially if you are followed by an immunologist or an infectious disease doctor. But I just had my patient just yesterday and I told her, you should definitely go get it. And she has diabetes and is on diabetic medication.
Thank you so much, Dr. Lara. A couple other sort of questions here, and you answered this in the chat, but I think it bears saying out loud. And that is, if you've already have had COVID, do you still need to get the vaccine?
Many infectious disease specialists have commented across the nation that it is still very important for those who have already had COVID to also receive the vaccine, because we are not sure what sort of natural immunity someone may have after getting COVID. With the vaccines, we know that we can boost up your immune response towards COVID and just create a stronger immunity against future COVID and other variations of COVID as well. And you can wait up to 14 days after contracting COVID and having gone through the course to go ahead and receive your vaccine. Just for an example, I know I don't want to get too personal, but my grandmother, who's 88, had COVID, and I signed her up to get her vaccine, or I'm trying to. So just so you guys know, I received my both doses of the Pfizer vaccine. I'm not gonna lie, the second dose was a little bit heavy. I did have a lot of body aches and I felt very tired. Nothing that a night's rest couldn't solve for me.
Just to follow up to that, Dr. Lara, you mentioned a night's rest solved it for you. How long typically do some of these side effects last? So you all have mentioned, potential fever, maybe some headache, maybe some fatigue or nausea. How long typically do these side effects last?
They may last for a few days. Normally, they should come up within the first 24 to 48 hours as your body is creating its immune response. If it's outside of that window, it's unlikely to be related to the vaccine.
Right. And is there, right now, you all spoke about there's two vaccines really being administered at present time, Pfizer and Moderna. Is one safer, considered safer than the other?
No, they're both of equal safety. They're honestly, between both of them, they're both really effective and they're both really safe with the almost identical ingredients put into them. Just a little bit different on the chemicals that keep it stable, but the side effects are the same. The adverse effects, which is the anaphylaxis, is the same, and the efficacy, which is the important part, does it work, is the same.
Right. So they're both, when you say efficacy, that means they're both effective. And I saw in the chat, Dr. Lara, you said after the second dose, 95% effective against the virus. We are going to be wrapping up soon. I just want to make a note to our members that we will make any information provided by the doctors available to you all. This is the first of hopefully other conversations. We hope to bring Department of Public Health and others to provide additional information as we move forward. But just really quickly, there's a question as to whether or not this will be like the flu vaccine. I know I get my flu vaccine every year, as do my kids. Do we expect this to be a yearly vaccine or something along those lines, something that we won't just sort of get once, but potentially be getting from now on or sometime down the road?
Yeah, it's hard to say at this time, but I think just having seen the way things are going recently, the fact that this virus is having many variations already, I hope it's not. I hope we can just be done with this. I don't think any of us want to experience another pandemic, but we'll wait to see. I think that is something that many of us in the medical community are, sort of looking out for at this time.
And to add, I think the more we allow the virus to see us change and adapt, the more time we give it, it's going to start being smarter. So that's why it's important that we are able to, vaccinate, stop it, keep ourselves socially distanced to avoid it from living enough to figure out, oh, this is the answer. And that's when we need to really look at the drawing board. And that's kind of like a big problem with the flu and why we had to take it all the time. A lot of people decide not to take the flu, and the flu is a smart virus that is changing. It wants to survive as much as we want to survive. So it's this constant back and forth. So that's why it's important that we really stop this virus at its track.
We have to wrap up here. We have other things to cover, and I want to thank you. But just really quickly, I'm seeing something in the chat that maybe you can clarify whether it's a myth or not. But how many cases, if any, do we have documented of people dying as a result of receiving the vaccine? That's one question. Dr. Gonzalez, I see saying 0. So just to confirm, we have 0 cases of people dying as a result of the vaccine. We all know, of course, that we have over 400,000 people who have died as a result of COVID. So thank you for just addressing that directly. And the last thing that we have, obviously, we are education workers. We work around other people. Is there a need to isolate after receiving the vaccine?
There is no need to isolate after receiving the vaccine, only for your own sanity to get some rest, but I'll leave that up to you guys. Thank you for having us. Please, do as much as you can to read from the CDC website, from the LA County Department of Public Health. They all have very good resources and information about the vaccinations.
Thank you so much, Dr. Gonzalez, Dr. Lara. We really appreciate you all taking the time. And hopefully, as new information comes out, we can provide additional platforms for education down the road. But thank you again for taking the time. Thank you for everything you're doing to serve the people of Los Angeles.
Thank you. Bye. And I'll send you the slides so you all can disseminate them.
Thank you, Dr. Gonzalez and Dr. Laura, for your awesome presentation. It was very helpful. There's a lot of misinformation out there, and it's important for all of us to know the facts. Now we'd like to learn more about what you think about the vaccine. So please respond to these questions, to these polling questions. How do you feel about getting the vaccine? Yes, I would get it as soon as it is available for me. No, I do not plan to get it. I will wait and see until more people are vaccinated. I am not sure yet. I need more information. You can vote now. Thank you for your answers. I know I will continue this conversation as the vaccines continues to roll out. I encourage you to learn more about the vaccine by visiting our website. It's SEIU99.org/coronavirus. Next, we will be getting to our updates on negotiations and other issues we are addressing with employers. You'll hear from some of our member leaders. First, we'll have Emilia Soto.
Hello, everybody. Can you hear me? Oh, there it is. I'm waiting for my something to come up. Okay, there we go. Okay, I just wanted to let everybody know from MAOF, I'm on the committee and I'm a steward. And a lot of people know me, so I hope I get to see everybody later on. I hope everybody stays healthy. PPE and social distancing protocols are in place at MAOF to ensure students and workers are safety. Well checks are in place. They're weekly. Proper PPE for those conducting tests. Like, and an example would be gloves, masks, etc. Contact tracing is occurring, and we are communicating with members, leaders, and membership during our recruiting monthly general membership meetings. Thank you so much. And for the next slide. Oh, I think I was just doing that one, and for nothing on another early Head Start program, which was options. There was no report for me on that one. Thank you so much.
Okay, Amelia, you will also be doing the Los Angeles Community College report.
No, I think I was doing MAOF and options.
Yeah, they have you down for the LA Community College
Not a
District
problem.
also.
No problem.
No, that's okay.
Let me read this out. The LACC bargaining team is quickly negotiating its updates on COVID-19, MOUs, and address issues such as COVID-19, paid sick leave, essential workers, accommodations for variable essential workers, and addresses and safety issues. If the district continues to reject or propose to solve the issue, our members need to be really ready to be taking action. The bargaining team is exploring permanent solutions to increase compensation for essential workers. Our internal organization staff is working with stewards and leaders to make sure that Local 99 is involved and all shared governance committees and distribution funds at each of the LACCD colleges. The next negotiation session with LACCD is scheduled for Friday, February 5th. That's coming up. Thank you.
Thank you, Amelia. Now we will have Demita for the report for LACO.
Good evening, everyone. For the SoCal units, the Los Angeles County Office of Education, most members continue to work remotely. Members with assignments continue to be provided with the appropriate PPE and in adherence to established public health guidelines. Joint health benefits bargaining with CSEA and LaCia has actually completed. It says continues here, but they've actually completed that. In regards to Compton Unified School District, members continue to be provided with appropriate PPE and training. They're working on a final draft of the Memorandum of Understanding, or MOU, to submit to the employer. They may need to schedule additional caucuses and meetings with the district. Next, Hacienda La Puente Unified School District. Conversations regarding the extension of the current Memorandum of Understanding continue. And for Linwood Unified School District, negotiations continue regarding the extension of current MOU regarding reopening of schools. We are in the process of determining the next general membership meeting.
Thank you, Danita.
You're welcome.
Next, we will have Agnes Bragas, please.
Good afternoon, good evening, everyone. I'm going to be talking about Montague Charter Academy. Negotiations continue regarding the extension of the current Memorandum of Understanding in place around reopening of school site. Next, Pleasant Valley School District. Full contract extended through June 30, 2021. No layoffs or reductions in hours to date or pending. Appropriate PPE and COVID-related training and procedures in place. Additional assignments are reasonably related to established duties by classification. Next one is SoCal Unit Santa Monica, Malibu Unified School District. Negotiations on schools reopening are scheduled to commence. Next, it will be Marisol.
Thank you, Agnes.
You're
Hello, everybody. Hello, shout out to my Valley people. Woo woo. How you doing? Okay, so the Accelerated School TAS has stated it is continuing to maintain a safe working environment, and members are continuing to be vigilant in this regard. The bargaining team is in continued conversations regarding the reopening of TAS. Next slide. SoCal units, Torrance Unified School District. We are working on the final draft of the Memorandum of Understanding to submit to the district. We may need to schedule additional caucuses and meetings with the district. Ventura County Community College District. Reopening plans limited to hands-on courses have been established for all 3 colleges with appropriate PPE training and assignments made for members. Whenever possible, members continue to work remotely. LAUSD, reopening of schools. Negotiations for a hybrid return to school models are complete. All agreements for distant learning reopening for units B, C, and F, and G are located on our SEIU Local 99 websites. Paid stipends of $5 is in place for all members assigned to work to a physical work location. Childcare services will continue for LAUSD enrolled students. Our agreement includes protections against layoffs and furloughs. LAUSD Safety Committee meetings, excuse me, discussions are ongoing over any concerns that arise and questions regarding testing protocols, testing locations, and appropriate PPE that needs to be provided at every location. Questions and concerns, please submit an inquiry form or an inquiry at www.seiu.com @99.org/inquiry/. And I think that's it.
Thank you, Marisol.
You're welcome. Also, you know what? I don't know if they see this, but it's also, there's a 2020 fall differential cutoff date. I don't know if it's further down, but there's a stipend calendar. Here we go. Stipend calendar located in the LAUSD website. There's also a hyperlink there. But as you can see, this is when if you are working at a remote location, this is when you're pretty much going to get paid for those hours, that extra. All right, thank you.
Thank you.
Back to you, Ms. Parker.
Thank you, Marisol. Now we will have Deanna Robles. She'll give us a report on childcare.
Hello, everybody. Hope everyone's fine, finds themselves safe and healthy along with your loved ones. Happy New Year. My name is Deanna Robles, and I'm a family child care provider in the city of Baldwin Park. and I'm one of the Local 99's representative on the Childcare Providers United CCPU statewide negotiation team. This year, providers across the state will be unifying our forces to fight for our first contract. That's right, our first contract. After a long 17 years of fighting to have our first contract, to have the right to have our union, this year will be filled with new beginnings and huge fights. Not only are we learning how to survive and navigate through this COVID-19 pandemic, but we're about to face one of the biggest economic crises California has ever seen. All this as we gear up for some of our local biggest contract fights. I know it's not going to be easy, but when we fight, we win. Again, when we fight, we win. And we will need to fight. The governor has already rejected our CCPU proposal on COVID-19 demands and has pushed off meetings with us until spring. We are sounding the alarm and are starting to put pressure on the governor and will need to put pressure on our local legislators. Childcare is an essential to the infection of our state. Without quality, accessible childcare, California's economy will struggle to recover. California needs to invest in childcare. We cannot do this alone. It will take every childcare provider in California to win this fight. But we can't do it alone. We also need the help of our union sisters and brothers and our community allies to make sure childcare gets the investments necessary to rebuild and recover California's economy. I urge all of you to support our fight by calling the governor at 1-844-243-9670 and demanding he get back to the negotiation table with CCPU. Again, if you can all please help us by calling the governor at 1-844-243-9670 and urge him to get back to the negotiation table with CCPU. Thank you and have an amazing night.
Thank you, Deanna. We know that politics directly affect our negotiations with employees and all the reopening plans. Here to share more about the federal and state funding and legislation in SEIU Local 99, Political Director Lester Garcia will give us an overview.
Thank you, Ms. Parker. I'm going to go ahead and share my screen. We'll do a quick presentation here on the budget overview as well as the legislation. So just really quickly, we want to give folks grounded in an understanding in terms of how the California budget process works. So for those of you who may not be aware, the governor proposes a budget. So he creates a draft of the budget and sends it over to the legislature, right? The first draft comes in January, and then we get a second draft in May. We'll talk a little bit about that in a second. And then he's responsible for signing the final budget that is passed by the legislature itself. Now in California, we have, of course, a bicameral legislature. So that means we have an assembly and we have a Senate. And there is a budget that needs to go through both and approved by both, or voted on, I should say, by both the Assembly and the Senate. So the Assembly and the Senate are responsible for passing all of the bills that will eventually become laws. And their other responsibility is to pass the budget itself. Now, the budget timeline, right? So in January, as you all have seen, on January 8th, the governor released his proposed budget. And I can't say that enough. It's a proposal, right? So what he does is he's saying to the legislature, this is where I'd like to spend. This is where I think all of the money from California needs to be spent. At the same time, in January, on January 11th, our legislative cycle begins. So our legislature starts, putting forward potential bills, potential laws. They start meeting to discuss it. It goes to committees, and they start discussing the fiscal impact of those laws, right? Now, in April, as we all know, April 15th is tax day in California and in the United States. Now, everything in the governor's proposed budget in January is an estimate of where they think the budget will be by the end of the fiscal year. We have to remember that the state of California, as most government agencies do, operate off of what we call a fiscal year and not a calendar year, right? So when we celebrate the year, it's January 1st to December the 31st. When the California school districts and all other government agencies, they operate it off of a fiscal year, which means their year begins July 1 and ends on June 30, right? So everything that the governor proposes in July is an estimate based on what they think they're going to get back in taxes, right? Once the tax day actually comes, then the state is able to actually determine, okay, this is how much we received in taxes from taxpayers in the state of California, which leads to what they call the May revise. So this is the governor's second draft of the budget. So in May, the governor, sort of based on all of the money that actually came in, all of the taxes that were collected, then provides a second draft of the budget. Now, the legislature is mandated by law to pass a budget no later than June 30th. For many years, they went past the June 30th deadline, but voters approved legislation that basically says if they don't pass a budget by June 30th, then none of the legislators get paid until a budget is passed. So you better believe that we've had an on-time budget passed for the last few years since that legislation was enacted. So this is just to give you a sense of the timeline. Now, by June, the good part of the budget is actually has been heard, has been developed. There are committees specifically on the budget that take place both in the Assembly and the Senate, where they discuss sort of the governor's budget, make tweaks to it, and then they go for a final vote by June the 30th, and that gets sent back to the governor. And the governor can sign it or make some changes to that budget, but it's generally pretty much always say baked by then, right? So, you can't sort of go back and put in new ingredients. It's pretty much done by that time. So the timeline is really important because we have to look at what is in this first draft and what are the things that we want to make sure need to be in there, what's missing, and what needs to be there in order to ensure that the needs of our members and the children that we serve are met. So here's the good part of the budget, right? So in childcare, we have 55 million that have been set aside or they're being proposed to set aside for COVID-19 relief in 2021 and 2022. 21 million to fund vouchers for the rest of the current 2020-2021 fiscal year. So like I said, the fiscal year operates off of July 1st to June 30th, which puts us just a little bit after the middle of the fiscal year right now in January, right? And so there's 21 million to help fund vouchers. A lot of our childcare providers have children with subsidized care, and this would go to that. 44 million in ongoing funding for 4,500 additional slots for children's ages 0 to 6. So that's the good news when it comes to childcare. When it comes to K-12, we avoid steep cuts in education. So last year, when the pandemic first hit and the budget process was going through, there were an estimated $18 billion shortfall when it came to the education budget. There's some things that the legislature did, like many of us, when we owe a bill and we don't have the money to pay that bill, we push that bill down the road. And that's essentially what California did. They deferred a lot of their payments. Now, what the state of California is doing with this budget, or at least what the governor is proposing with this budget, is paying off some of those deferrals so we can avoid any potential cuts to education, at least for the time being, right? Now, 4.6 billion has been proposed to be to extend learning time, sort of recognizing that even though our teachers and our paraeducators, our TAs, our special ed assistants, all these folks have been doing everything they can to make sure that our kids are learning in distance learning. We still recognize that there's going to be some extra time needed to be able to catch up. So 4.6 billion is being proposed for extended learning time, including summer school, right? As I said before, there's a payoff of deferred payments from the 2020 budget. And the other good news here on K-12, 260 million in one-time money for community schools. This is something that our local has taken leadership on over the last few years, and it's basically making sure that there are resources in place to support students and families, everything from mental health services to health services and all the other things that our families need in order to be academically successful. On the community college front, there's an overall increase of 372 million in total funding. There's 100 million of that is one-time support for emergency student financial assistance. We have, We have a higher rate of students in poverty in the community college system than we do in the UC or the CSU or the private college system. And so there's 100 million set aside to support financial aid. Along those lines, another $100 million one-time dollars to support food and housing insecurity for community college students. As it relates to workers, there's 15 million in ongoing money. So, you know, the difference obviously between one time and ongoing is one time is one time. So they're just proposing it for 1 year versus ongoing says this is going to be a part of our budget moving forward from now on, right? So 15 million ongoing to augment California apprenticeship initiative. So this is workforce development and training for both students, but also for the existing community college staff. 20 million in one-time money to expand work-based learning models and programs at community colleges. This is more focused around professional development and other opportunities for our members to be able to grow in their jobs. Now, here's the bad. So for all of the good things that are in the budget, unfortunately, the budget falls way short of where we need it to be. On childcare, the budget fails to account for our contract. We're currently negotiating a contract. There is nothing spelled out in the budget that says this is how much we're setting aside to make sure that we land at the right place where we need to land with our childcare workers in the state of California. There's no money outside of federal relief funds to directly address closures. As you heard our sister Deanna say, we're in negotiations now, and we are facing an absolute and immediate crisis when it comes to family childcare providers here in the state of California. As of December, we have 6,000 family childcare providers who have closed their doors in the 10 months of the 2020 pandemic. That is over 60,000 children who are losing slots. And while there is some money that is coming from the CARES Act that is being put towards addressing some of these closures, it's not enough, and the state itself isn't putting any skin in the game to make sure that those closures are addressed. And as you saw before, they do have an expansion of 4,500 slots in the state, but those 4,500 slots pale in comparison to what we've lost so far. Now, the other thing here to note is priorities being given on the early ed front to TK programs. Now, we represent members both in family childcare and also in early ed in programs like MAOF, Head Start, but also in early ed centers in districts like LAUSD. Now, what's being proposed here by the governor is an increase in investment of $500 million in TK. Now, while TK in and of itself is not a bad program, and there are many children who benefit from transitional kindergarten programs, what the contention that we're making here and the concern that we have is that at a time where our family childcare providers are closing rapidly, and just to put into perspective, during the 2008 recession, 5,000 childcare providers closed their doors. We're well past that already, and we're only 10 months into this crisis. And so our contention here is that we need to deal with the immediate crisis before we start expanding into new services and new programs. On the K-14 front, the school reopening plan, for those of you who are on at the beginning of the meeting, Max referred to this. The school reopening plan prioritizes districts in more affluent and white communities. So the $2 billion from Prop 98 that have been set aside by the governor, these are what they call, you might have heard them called in-person instruction grants. What it says those districts that are ready to open, here is some extra money, anywhere from $450 to $750 per student in order to open. And you have to open by February, or at least have plans in place to open. And they would be required to open TK through second grade, and then by March make available all elementary school make elementary school available for in-person instruction. Now, why this rewards affluent and white communities is because we know that communities of color, namely Black and brown communities, have been the hardest hit by COVID. We know that the conditions in our communities were bad before the virus hit. We knew that we had staffing issues, budget issues before the virus hit, and the virus is only making operating schools all that much more expensive. We are of the position, our union is of the position that we need schools to get the money so in order to be prepared to open, as opposed to rewarding those communities where their cases are lower. And the cases are lower in more affluent communities, in more white communities. And what the governor is proposing here, frankly, is a segregated reopening of schools. So again, the overall, the budget fails to address higher operating costs related to COVID. We're going to have less kids for class. That means more classrooms, which means more cleaning, more sanitizing. If you can only have for example, our school buses, we used to be able to put 45 kids into a school bus. We're not going to be able to do that anymore and still enforce social distancing guidelines. And so if we're going to be operating at maybe 20, 25% capacity, we're going to need an aid on those buses to make sure that the physical distancing rules are being adhered to, because we can't expect a bus driver to enforce those rules and safely drive a bus. And B, we're going to need potentially more buses and potentially more bus drivers, because we'll have less kids per bus to transport. And so all of this fails to address. We know that our staffing levels in building and grounds were abysmal before the pandemic, and we definitely don't have enough right now to make sure that every campus is clean, safe, and sanitary once they reopen. The last thing I'll say that is on the bad side of things with this budget is it proposes using $2 billion to pay for vaccinations and testing in order for schools to reopen, or once they reopen. And those $2 billion are being paid for out of Prop 98. Now, Prop 98, really quickly, is basically a guarantee. It's a law that voters passed some 30 years ago that guarantees that 40% of California's budget, no matter how high or how low it goes, will always go to schools. Right now, when you see that the state is relying on like CVS, Walgreens, Dodger Stadium to administer the vaccine, all of those places are receiving money from the health part of the California budget. What they're doing, what the governor's proposing here, is that we take money out of the education part of the budget to fund the health side of what's going on in schools. And what the contention that we have is that those $2 billion should be coming from the health side of the budget, not from the education side of the budget, because as it is, we do not have enough. So really quickly, our union's legislative priorities, some of you might recognize these. We've been fighting for these for some time. First and foremost is revenue. We all fought to pass schools and communities first. Unfortunately, rich corporations spent over $100 million and spread lies to California voters, saying everything from rent was going to go up to food was going to go up to it was going to close the barbershop down the street, when in reality, all the taxes were aimed at the major corporations like Chevron, Disney, McDonald's, and those places. And so our number one priority has to be, even though the tax receipts came back higher and we're not facing cuts immediately, we do expect in 2 years from now to have a significant deficit. And like I said before, and as Max alluded to at the beginning of the meeting, we're not trying to get back to where we were before COVID, because we know that before COVID, we were not in a very good place with our schools. We need to move past that, and we can't do that unless we make sure that the rich pay their fair share in taxes. The next legislative priority has to do with reopening the economy, right? You can't, and this is tied intrinsically with the reopening of schools. You cannot reopen the economy. You cannot have this economy rebound without making sure that our schools are clean, safe, and sanitary. So we're demanding legislation to support testing, to support vaccinations, closing the digital divide, not only for students, but also for staff. As we've seen, a lot of primarily Black and Latino students are the ones that have least access to reliable internet and to the devices they need to stay engaged in their learning. And that is reflected of the school staff as well. We want to make sure all of you have reliable access to internet and have everything you need to be able to participate potentially in hybrid learning. Now, we want to make sure that there's layoff protections. As we've always seen in the past, classified employees are always the first to go. Last year, our union and our members were able to push to get layoff protections for certain class of workers. We've been able to negotiate at the table the prevention of any layoffs for this year. We want to make sure that the state is, and even though there's no plan right now at the local level for layoffs, we want to make sure that the state, we have that state protection of any potential layoffs if we do have districts like Santa Monica, Malibu did this last year, where they try to lay off protected class of workers that we were able to get protected through the state. Now, the other thing we want to make sure we have is criminal that California does not have, and that is standards and money for clean, safe, and sanitary schools, right? So Districts always make decision on how much they're going to put in to cleaning and sanitizing schools. And we knew that going into the pandemic, LAUSD, for example, only funded 40%, less than half of what they have determined their minimum standard of cleanliness. So what they say is it's going to take this much to clean the school. We're going to give you less than half the money to be able to do that, right? That can't fly. Not, we've been saying it for years that it is a health and safety issue. We know now there are 400,000 people that are dead of our fellow Americans who have passed. Clean, safe, and sanitary schools are a must. You can't simply have something say, well, you know, if you want to put your money there, you can. We need a standard for the state of California, and we make sure that standard is funded. Support for family childcare providers. Now, we want to make sure that our family childcare providers, they often do not have the institutional support. They don't have the luxury of having a district say, or us being able to negotiate with a district that says no more layoffs, right? We've seen 6,000 childcare providers close. They need support for PPE. They need direct financial assistance, and so many other things that we're trying to bargain for at the table. But we want to make sure that the legislature is also putting their part to make sure that these essential workers are protected. And then next to last, we have been advocating for the last couple of years increase money for our special ed students. We know that our special ed students are among our neediest, and that require more attention and support. Unfortunately, the state of California gives you the same amount of money no matter what the need is of that student. We want the amount of money to be tied to the need. So we want to make sure that the state is providing additional funds for our moderate to severe students, right? We know that districts like LAUSD, because of the work that our members do, have created some really stellar programs. And so it attracts parents from all over the region who send their kids here. So we have a higher concentration of children with moderate to severe disabilities, and we want to make sure that the funding is there to support that. Lastly, in terms of our legislative priorities, we want dollars to continue to fund the Summer Bridge program. We were able to get 60 million a few years ago when it passed. We got another 36 million after that, and last year we got an additional 50 million for the program, and we want to make sure that we keep that up. So I'm trying to go through this as quickly as I can. I know we don't have a whole lot of time. We have other things to get to. So really quickly, while we're on the subject of Summer Bridge, we just want to share some information. All of this recording will be available if you want to come back and review any of it, and also check our website once for updates on this as well. So the Summer Bridge program, also known as the Classified School Employees Summer Assistance Program, was fought for and passed by you, Local 99 members. We passed this back in 2018 to deal with the fact that a lot of our members don't have work over the summer and don't have access to unemployment insurance. So the way that the program works is, as an employee, you can set aside up to 10% of your pay. It's taken directly out of your paycheck throughout the school year, and the state matches your contribution 1-to-1 if you don't have work the following summer. So for example, if you apply for the program this year, then starting in the fall of 2021, they'll start taking that out of your check. And then by summer of 2022, if you don't work for the district, it doesn't matter if you work, for Lyft, or you work at Target, or you work somewhere else. If you don't work for the district, then you're able to not only have access to the money you set aside, but the state will match it 1-to-1. Now, I should say the only caveat there is that if there is more demand than there is money in the budget, then that 1-to-1 match starts to drop. And you get less of a match. However, because of the advocacy and because of the involvement of our members, we've been able to get the program funded every single year. And that's why it's still a legislative priority going into this next year. We want to make sure the program continues to be funded. Now, who can apply? I'm going to run through this really quickly. Again, all of this is going to be available on our website, and I will show you the website, where to go on our page in order to get more information and have all of this plus other criteria at your fingertips. So who can apply? District employees who work 11 months or less per year. So if you're a 12-month employee, you do not qualify, as the program is designed for people who don't have work in the summertime. Any employee, and on top of that, I should say, This is an and, not an or. Or excuse me, this is an or situation here. Employees earning less than 62,400 per year. So if you earn less than 62,400 per year and work 11 months or less, the chances are you qualify for the program. There are certain exceptions. The status of TAs are not technically classified employees, and this is a program for classified employees. It's something that we're taking up with the state. It's something that we're taking up with the California Department of Education, and making sure that you all that we all have access to that. When and how do I apply? The enrollment window opened up in January 1st. A lot of our school districts represented here sent those notifications out back in December. An LAUSD is an online application. All others submit via mail, except for Torrance, which is asking for in-person. We're going to clarify that with Torrance to see if that's still the case and make the argument that folks should be able to mail in their application given the current threat of COVID. So I know I put a lot of information out there. If you want more information on how to apply, who qualifies, and we have a really great frequently asked questions there. I would say visit this program. If you go through all of the questions, the FAQs, you look at the application and you still have questions, and you feel free to fill out an inquiry form, reach out, and we will have somebody get back to you on any additional questions. But that website is seiu99.org/summerfund. SEIU99.org/summerfund. I'm going to say it one last time, SEIU99.org/summerfund. And you can click on the highlight there where it says Summer Bridge Fund applications, and it'll show you based on where you work, who to send it to. And we have a link there for the online application with LAUSD as well. Vice President Parker, that's my presentation. That's my time. I'll hand it back to you.
Thank you, Lester, for that wonderful presentation. Now we're going to open it up for your questions. We're going to take some of the frequently asked questions we received at the registration during this meeting. I want to remind you that if you're joining us by phone, please send your questions through the online form on our website at seiu99.org /inquiry. Organizers will follow up with you in a couple of days. In the coming days, please be patient. Also, due to the members' questions, we won't be able to respond to everybody during this meeting. But if you send a question, by any means, you will hear back from an organizer in the next few days. We'll also be posting a recording of this meeting at our website, seiu99.org, so you can review all of the response. Now I'll turn it over to Blanca from our communication department, and she will help facilitate the questions and answers.
Yes, thank you very much, Elizabeth. So we received many questions regarding the vaccine, and Doctors Gonzalez and Lara, I think, did a great job of addressing many of those questions related to healthcare and those concerns that members had. But we also received a lot of questions regarding the rollout of the vaccine, and of course, ongoing questions about COVID. So during this portion, we're going to address try to focus on some of those worksite related questions on the vaccine and COVID. So the first one it's kind of a two-part question, and that is, can the school districts and other employers make vaccines mandatory for employees? And what if someone chooses not to be vaccinated? So I'm gonna direct that question to Pam Stevenson.
So far, hi 99. So far we have heard from the superintendent that LAUSD is making it mandatory. Can the employer make it mandatory? I'm going to say yes. What was the other part of that question?
What if an employee chooses not to be vaccinated?
I do know that we haven't received the actual document. Once we do, we will post it, but to my understanding, there will be options based off if you have an underlying issue that prevents you from taking the vaccine, or for religious beliefs. And I know that they have a process that they're gonna try to use. I think it's the interactive process on trying to address those issues and keep you employed. But with the understanding that if they cannot accommodate, it may lead to separation. So I want to be real clear about that. And people are going to have make some hard decisions based off of what the employer provides, if they mandate it, so on and so forth.
Thank you, Pam. The next question is, when will classified employees be able to get the vaccine? Again, I'll direct that to you, Pam.
Again, that will depend upon the employer. I do know that LAUSD had sent us information that they are trying to secure enough vaccines, since they have made the announcement that it is mandated to for the staff to be vaccinated. We haven't heard from the other employers, but please know that we are reaching out to figure out what that plan is. And please continue to check our website, because as soon as we get that type of information, we post it, and follow up with your reps regularly. They should be able to assist with that.
Okay, thank you.
If I can just add to that really quickly, Pam. So at the county level, as you all know, education workers fall under what they call Tier 1B, which is basically after all healthcare workers are done at the county. We're sort of next in line. Healthcare workers are still, as you'll have probably seen in the news, the state and the county are way behind on the number of vaccinations, being able to get those out. So we would be, like Pam said, the districts are still waiting to hear back. The county is starting to tell us that that they expect those vaccinations to start going out sometime in early February. But as Pam said, it all depends on when those get to those specific employers. So keep checking the website.
Thank you, Lester. Related to that is, will workers working at the grab and go sites or at other on-site locations, will they get priority to get the vaccine since they're working on site?
To my understanding, as soon as it gets to the tier that Lester was just speaking about, once it gets to teachers, that means it's going to all of the employees that work in the school sites. So they will be included. When it gets to the teachers, it will include the people at the food and go, grab and goes.
Okay, thank you. Are we going to be able to get the vaccine at the school site?
At this time, because of the announcement from the superintendent, I reached out to Labor Relations, and they are trying to secure those vaccines. And the plan is to try to organize that so that they can get it at the COVID sites. That's the plan, but they have not finished those discussions to give it to us so that we can post it.
Okay, unrelated to that, will employees' family members be able to also get the vaccine at school sites?
We know that LA County is committed to making sure that all of the communities in LA get the vaccine, and district did share with me today that if they have extras over, they will be trying to figure out how to get that to staff that have family members within the household that need the vaccines. But they don't know, we don't have the plans yet. That has not been given to us. And I know that they will be submitting something towards the end of this month that should be coming out as to information around the vaccine, the instructions on where to get it, how to get it, what to do if you can't because of underlying issues or because of religious beliefs. So all of that information is going to be in the documentation that they send out. However, we don't have it as of yet. As soon as we have it, we'll post it.
Thanks, Pam. So this is a question that came in different forms from members at the LA Community College District. So this is from a member who says, I have been using family medical leave to take care of my children when their school is closed and there's no one to take care of them and support them with their school, their distance learning via Zoom. So is there a better solution to working 50-50 shifts so we don't have to struggle with childcare? This is from the LA Community College District, and I'm going to direct that question to Manny Rangel.
Good evening, Local 99 members. I miss seeing your faces. So thank you for your question. Member leaders and LACCD have been fighting really hard to protect essential workers in LACCD. The answer is if you're an essential worker and are 65 and older, have an existing medical condition, are living with older individuals or individuals with pre-existing conditions, or do not have childcare supervision for children under 16 years of age, you should submit a request for accommodations to management in your department. We strongly advise you to submit that request for accommodations in writing. If you need assistance, you should contact our Member Resource Center at 213-637-0296.
Thank you, Manny. The next question is related to sick leave and paid sick leave due to COVID. It's why did they take CCFRA away? I work at a COVID site and any little symptom we get, and they say we can't work and was quarantined for 10 days. We don't have enough illness days. What can we do if we need to quarantine and don't have sick leave? So I'm gonna direct that to Pam, but perhaps also Lester can address some of the, maybe some of the aid that's coming from federal and state.
Well, my discussion with District today was concerning just that. So we know that it's the FFCRA, it ended, those federal benefits ended on December 31st. We know that the new administration that's in place have a new package coming out, but we don't know what's in it as it pertains to that. I did talk to District about a situation similar to this. If you're in that type of situation, please reach out to your rep. We're gonna be reaching out to District in those particular cases to see if folks can use the MSND and then try to get them to restore their hours back if if the new package has a federal benefit. But those are for people that fell through the loop, that got sick from the 31st up until, I think she said February 1st. So keep checking the website. The more information I get, we'll post it, but that's the information I got about folks that are falling in that loop and running out of sick leave during this time since the benefit ended on the 31st.
Yeah, and just Blanca, a quick update on the federal and state. We saw that Congress did pass a package back in December. Not all of that has been doled out, and it's not clear completely what is actually in it and where it's going to go in the state of California. And obviously, the Biden administration has proposed a $1.9 trillion plan that includes everything from vaccinations, but there's also money in there for childcare and K-14 as well. All that to say that if we're going to get these things back, and if we're going to be able to push for these things, just like we do at the table, we don't get anything unless we push for it with the districts, unless we organize. We have a similar situation with our state and federal government. And so keep checking our website, make sure you've downloaded the Outreach Circle app, and make sure you've opted into our texting, because we will be sending out information really soon about ways that you can get involved in pushing the governor and pushing the state legislature to make sure that these programs are in place so that our districts can actually provide the benefit. And at this point, it's not even a benefit, it's a matter of public safety.
Thank you, Lester. Okay, and I think this will be our last question. It's a general question, I think related to contract negotiations, and it's the cost of living keeps going up. Are classified school employees going to get a raise?
Is this for LAUSD?
Well, I think it's general, so I think LAUSD and other employers.
Well, let me just say this. I know that because of the COVID crisis, we know that there are a couple of contracts that are due for full contract negotiations. Specifically at LAUSD, I know that we had planned on starting negotiations in March. Because of the fact that the vaccines are now becoming available, that has become the priority. With that being said, I have a estimated date from district of mid-April, end of April, for full contract negotiations. And yes, we will be asking for all of the retro and we had a reopener that we were in the middle of right at the beginning of COVID. That has been included. We have combined the two. So anything that we negotiate would be retroactive, but the negotiations is on hold while we figure out this vaccination piece and trying to get these schools open. And it's projected for April, mid-April, end of April. The other employers, there's a few others. I can't really speak to them. I don't have them off the top of my head, but we'll make sure that we post any information we have about upcoming contract negotiations on the website so that people can follow up. So continue to check it, okay?
Great, thank you. Okay, so now we turn it over to Elizabeth, just to close out our meeting. And thank you, everyone. Again, the meeting, the recording will be up on our website. If you have additional questions, please submit them in the inquiry form. And if you did send them in through the Q&A, they'll be addressed and you'll expect to hear from an organizer. So thank you. And Elizabeth, it's all yours.
Thank you all for joining us today. As we start the new year, we know that we have a lot of work ahead of us, but I know together we can meet the challenges ahead. Take care, everyone, and have a good night and stay safe.
Good night, everyone. Stay
Bye-bye.
safe.
Good night, y'all.